How is morning stiffness a symptom of RA? Imagine waking up and feeling like your joints are glued together, making even simple movements difficult. That's what many people with rheumatoid arthritis experience as morning stiffness. This stiffness is a key sign of the disease, which is an autoimmune disorder where the immune system mistakenly attacks the joints, causing inflammation and pain. The inflammation causes the tissues lining the joints to swell and become tender, leading to stiffness that is often most intense right after waking up and can last 4 hours. Usually, gentle movement and activity help loosen the joints and reduce stiffness, but the initial hours can be quite challenging. The reason this stiffness happens is linked to how inflammation and the body's internal clock, called circadian rhythms, interact. In rheumatoid arthritis, inflammatory proteins called cytokines are more active at night and early morning. This increased activity leads to more swelling and stiffness when you first get up. The body's circadian rhythm also influences hormone levels, like cortisol, which normally helps reduce inflammation. In people with RA, cortisol levels are often lower in the morning, which means less natural anti-inflammatory effect during those early hours. This imbalance contributes to the stiffness and discomfort experienced upon waking. Another factor involved is called the gel phenomenon. During periods of inactivity, such as overnight sleep, a gel-like substance can form in the synovial fluid, which lubricates the joints. This gel makes the joints feel stiff and rigid after rest. Moving around helps break down this gel, easing stiffness and restoring joint mobility. That's why gentle stretching or light activity in the morning can be beneficial for managing symptoms. Morning stiffness can significantly affect daily routines, making it hard to get out of bed, dress, or perform tasks that requiring joint movement. It can also impact work and social life, sometimes leading to adjustments in daily schedules or even early retirement in severe cases. Because it is such a prominent symptom, doctors often consider morning stiffness when diagnosing rheumatoid arthritis and assessing how active the disease is. Treatment for RA aims to control inflammation and reduce symptoms, including morning stiffness. This can involve medications like disease-modifying antirheumatic drugs and biologic therapies, which target the immune system. Lifestyle changes, such as regular gentle exercise, maintaining a healthy weight, and good sleep habits, can also help lessen morning stiffness. It's important to remember that each person's experience with RA is unique, so managing symptoms often requires personalized approaches. If you notice persistent morning stiffness or other joint symptoms, consulting a healthcare professional is essential for proper diagnosis and treatment planning.